Hello and welcome to the latest edition of WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. April is National Donate Life Month, a time to raise awareness about organ, eye, and tissue donation, as well as to encourage Americans to register as donors. Today, we're focusing on heart transplants. Did you know that more than 3,800 people in the U.S. are on the heart transplant waiting list? Today, we're talking about heart transplants with Dr. George Sokos, Medical Director of Cardiac Transplant for the WVU Medicine Transplant Alliance. Welcome, Dr. Sokos, to Tuesday Talks.
Thank you for having me.
It's great to have you here. We've had a lot going on this month for Donate Life Month.
Yeah.
We just mentioned that there are 3,800 Americans on the heart transplant waiting list. Now, given the rate of heart disease we have in West Virginia, I imagine there may be a fairly large number of West Virginians on that list.
Yeah, I mean, we're a pretty large state, so there are several people on the list in West Virginia, but even more that we're evaluating for transplant. Obviously, with such a precious commodity of heart transplant and the lack of an organ, you can't just grab a heart off the shelf, right? So we're very careful on who we place on the list and how we evaluate them. But the need is great. I mean, we probably, per capita, we have a lot higher rate of coronary disease, heart failure, and those sort of things. So absolutely, yes.
Sure. Now, up until a few years ago, you couldn't get a heart transplant in West Virginia. You had to travel out of state. But that's not the case anymore with the WVU Medicine Transplant Alliance. Can you talk a little bit about that?
In fact, I was one of those out-of-state providers.
Yes, you were.
Before coming back here. And that's really why I came back, because, I'm from West Virginia. I really felt that it was important to be able to provide all services to the people of West Virginia and to really cut down on the travel. It's stressful enough to be to require a transplant, right? If you're sick enough to need a heart transplant, the stress to you and your family is enormous. And to be able to take just a little bit of that down a little bit by cutting down the travel and at least being around people that you know and people that have the same values and really same culture as you, it really means a lot. And we do it just as good and better than anybody else in the country. So our outcomes are better than most in the country, and we feel like we have a great team and brought a lot of good people in from a lot of different places, which really I tried to bring in the best people from around the country so that we brought the good from each program to bring it into ours to make it the best. And I think so. To sum that up, it's really nice to be able to do that here, to bring full circle. I've been here 5 years now, and we had nothing from that aspect when we got here, and now we're a full-fledged, accredited program, and it's going well.
And that's impressive in just a matter of 5 years, too. Now, you were part of the team that performed the first heart transplant in West Virginia in November of 2019. What was that like? I mean, I know this is always a huge team effort.
Yes.
But
I say this. Really, when I talk to my patients about this, that it takes really an army to make this happen. It's not just the doctors. That's what you see on the front end, but it's the nurses, it's your nurse coordinators, it's our pharmacists, our dietitians, our social workers. People don't think about that, but there's a lot of things that need to happen to make sure that people have the right resources for them. Our finance team, the whole inpatient team, the outpatient team, the lab. I mean, so it takes a lot, and then we have to put protocols together and. So that we ensure that they get the right care every step of the way. You don't want to miss anything, right? So you really have to have everything's airtight. It was awesome. It was a really cool experience. It still is. I mean, it was cool to be the first, to have the first one, but to me, each one is the same. Yeah, because you're saving someone's life and you're giving someone several more years with their family. And it's a good life too. It's not just about you don't want to do something just to keep people alive, right? You want them to actually live their life and enjoy life and get out there and do what they want to do. Like they want to get back to golfing or hiking or just playing with their grandkids. I mean, simple
Yeah.
stuff, right? I mean, you can't even do that. When some patients with, severe heart failure, they can't even do the simple things. Can't shower without taking a break. Can't do those sorts of things. And so to be able to give that back to them is pretty awesome.
That's a real miracle, isn't
it
it?
is. It is, and it's like I said, it's the surgeons, it's us, it's everybody, and then when you're doing it well, it just runs like a well-oiled machine.
That's great. Is it fair to say the WVU Medicine Transplant Alliance is on the cutting edge of heart transplant technology, pioneering new techniques, one-of-a-kind programs?
Absolutely. I mean, I think, if you think about this for a second, we were the only program to start in the middle of the pandemic. So, you mentioned
my
that
gosh.
we
Yeah.
started our program November of 19, and then the pandemic hit. So yeah, we had to be innovative, right? To maneuver around that, obviously there are national guidelines and things in place where there are ways to do things, but absolutely we're on the cutting edge of things. And as new things become available and new techniques become available, we move to those appropriately. You don't want to be doing. I don't think you ever want to be the first to do some of these new techniques as far as when it comes to transplant. I'm not saying you don't want to be one of the first.
Right.
But we're a smaller program, and we have to be we have to be cognizant of that. We have to, protect our patients and understand that when you are, a small to mid-sized program like us, which is honestly almost every program in the country is our size. There are only a few larger ones, but we're like, the majority of the programs in the country. You have to be somewhat more respectful of what you do. Because, again,
Sure.
Our outcomes matter. I mean, not that we don't care about each individual patient, but you also worry about the outcomes of the program so that you can say, you want to be able to continue to provide that, right? You don't want to do something and not do it well.
Exactly. So I imagine there's an advantage to being smaller.
It is. It's to me, it's that more personal experience. I mean, we know every single one of our patients. I know everything about my patients. They know everything about us. So it's kind of a two-way street in that aspect. And they become part of our family, to be honest with you.
Yeah.
I tell them, you just gained a family member because we're going to be hounding you to make sure that, and most people, I mean, again, people who get transplanted, they respect that and they respect the gift that they've been given. But everybody needs a little push every once in a while, and that's what we're there for, right?
Yeah.
And you think about if you love your family member, you're going to always push them a little bit more so that they're okay. And that's what we try to do.
Absolutely. Wow. So we need donors, obviously.
We do. I'll say this, we've had, the last 2 years, we've had record numbers of transplants. But that doesn't mean, which is great in the U.S. But there's still people dying every day waiting for an organ. So, I encourage everybody to be a donor. It's simple.
Yeah. How do we register to be a donor?
You can register through our website. It takes you to that. But the easiest way is to register when you get your license. I mean, you can do that. It's simple. But if you go to the WVU Transplant Alliance website, there's a simple link to become an organ donor, even if it's not on your license. So multiple ways to do that. And if they're not sure, just call us. We're happy to provide the ways to do that.
Yeah, I have a website here, registerme.org/WVU Medicine. You can register to be a donor. And I think you can also register when you get your hunting license.
I think any license you can get. I think even fishing license too.
Oh, wow.
It's very simple. So it may just be hunting. That one I'm not sure. If you're bringing a new one to me there. So.
Okay.
I tell people it's easy, but because it is, because again, we have to provide the link, and anybody with a smartphone can get to it, or even access to a public library for that matter, right?
Right. However, but it's easy. You're making it as easy as possible because we really do need donors.
We do. Obviously, right? I mean, we don't want people to die to become a heart donor. You have to pass away.
Yeah.
But other organ donors, there's a living kidney donation. So there are ways to help people. There's bone marrow transplant. There's all kinds of other ways that. But we just encourage everybody to say yes to being a donor, and then one myth I'd like to really dispel though, when you say yes to becoming a donor, it does not mean that we don't take care of you, right? People worry about that. If I'm becoming an organ donor, I get to the hospital, I'm sick, they're just not going to take care of me and let me die so they can use my organs.
Yeah.
Nothing could be further from the truth. I mean, we do everything possible to save every patient.
Sure.
because I mean, that's someone's loved one, right? I mean,
Absolutely.
so, but if we're to the point where that person can't be saved and they can help save someone else, there's no better gift, and it's really provides a gift to family members, to people who lost their loved one, that organ is providing life to someone else. We had our flag raising ceremony the other day, and I had the real pleasure of meeting the family of the donor of one of my patients that I had before I came here. And that was a really moving experience. I'd met them before with him. And I mean, it's all over Facebook. It's, Heather Mudrick and Donnie Ott is the patient's name who got transplanted. He's very much, a proponent of organ donation, obviously.
Yeah.
And so is she.
Yeah.
And it gave her a lot of peace and closure, and really kind of an understanding of why that kind of had to happen.
Yeah.
Which I mean, that's hard to do. I mean, I don't know, right?
Yeah.
I mean, I don't.
It's emotional.
It's very emotional, and it's emotional for us as physicians, right?
I bet.
When you, it's kind of easy to see it on one side when you're just worried about you're the recipient, right? You worry about, okay,
Right.
how can I save this person's life? I'm doing everything I can, but we take a second and think that someone else just lost their life here, and me personally, I always try to say prayer for that person and their family, because I think that's just to give them some peace, but also for the recipient. So that's how I try to handle it.
You have to be sensitive on all
You
fronts.
do. It's you get so caught up in trying to save our patient, you can't forget that aspect of things.
Yeah, it's someone losing their life to save a life.
Yeah. Yeah.
So, we do need donors. Can anybody be a donor? I mean, can you be too old to be a
heart
donor?
donors, for a heart, yes, but I would say anybody can be a donor. Sign up. I mean, you never know, any kind of tissue, eyes. There's all kinds of things that can be used. So I would say there's no reason why you shouldn't. I mean, because in the end, what happens is if you are a donor, we evaluate the situation, and if something can be used from you as a gift, then they'll use it. That's CORE's job. Or locally, that's our organ procurement, and that they run things around this area, the Pennsylvania, West Virginia area, and they determine it, right? They look at things,
Right,
and so
right.
I encourage everybody, be a donor, and let us worry on the back end as far as whether we can utilize things or not.
You can make that judgment.
Yeah.
Yeah. I imagine when it comes to advanced heart failure, heart transplant is the last resort.
Absolutely.
And can you talk a little bit about the treatment options for advanced heart failure patients before you go to heart transplant?
I mean, we try very hard to utilize medications first and foremost, right? Because if you can take a pill and avoid going through this whole process, I mean, who wouldn't want to do that, right? I mean,
Right.
I mean, because we have a possibility of recovering the heart to back to normal, or improve to improve everybody's daily life. So we try really hard to do that first. If that fails, we have there's other devices that we're able to use. Certain kinds of pacemakers can help. There's other implantable devices that can help the heart to try to improve. And if all the smaller invasive procedures don't work, then we have something called an LVAD, or a left ventricular assist device. That's an open heart surgery that it's basically it's like an artificial heart, but your heart stays in, and it assists, like it says, it's a left ventricular assist device that assists the heart to work. And we can utilize that to bridge someone to transplant. Sometimes
buy some more time
it
until
does.
they can be.
And sometimes they can actually recover. We've actually, you can put that in, and the heart gets better, and you take it out, and they don't need anything. So,
I didn't realize
yeah.
that. Well, we're talking about advanced heart failure. What are the symptoms of advanced heart failure?
So we talked a little bit earlier. So really shortness of breath with daily activities. When showering, can't walk upstairs. Have to take a break when you walk upstairs.
Wow.
Swelling in your legs. Waking up short of breath in the middle of the night, having to sit up straight. Really fatigue is probably the biggest one. People don't think about that, but just being extremely tired all the time, really not the desire to do things. Sounds a lot like depression, right? But heart failure and depression go hand in hand. When you can't do the things you want to do, you do get depressed, which is something that that's why we have multiple members of our team to help. We have psychiatry and social workers to really kind of tease that out as well. So yeah, I mean those are the main ones. Sometimes people lose their appetite just because of the lack of blood flow to the stomach and everywhere else. They don't feel like they want to eat. Weight. We talk about weight gain with swelling, but sometimes it's just weight loss we call it cardiac cachexia, which means that your heart failure is so bad that you lose your appetite and don't want to eat anything.
Oh, okay. Okay. Well, what does it take for a patient to be recommended for a heart transplant? Like who's a good candidate for a heart transplant?
So someone with all the symptoms I just talked about.
Yep.
So you want to, again, we try everything that's possible with medications. You want to be evaluated by an advanced heart failure cardiologist, such as myself or my team. I have 5 other cardiologists on our team that do advanced heart failure. And then if we determine that we've really pushed the limits to everything else that we can do, we recommend them be seen by our transplant team. And that transplant team includes transplant coordinator, transplant pharmacist, transplant dietitian, transplant finance, transplant social worker. So really, we work hand in hand with everybody to undergo that full evaluation. Mm-hmm. Now, typically, there's no hard age cutoff, but we say above 70. Typically, most patients aren't transplanted. There's, everybody's a little bit different, so we don't like to say there's a no, absolutely not. But as a general rule, above 18 to be an adult transplant center. Otherwise, you're at a children's transplant center.
Yeah. We just did one last year, didn't we?
Not children's.
Okay.
No.
All right. I'm thinking another one.
Yeah. We've done some really cool children's surgery. Now we have Dr. Massio here right now.
Yeah.
He's fantastic, and his team that he's putting together at children's. So.
Yeah.
But I would say, if someone's extremely obese, they're not going to be a heart transplant candidate. So we look at body mass index, and typically the cutoff is 40 for that. So you have to have good control of your diabetes. These are things that we push hard. We know someone has advanced heart failure. We try to get all these things in order before we move towards transplant. So things like that. Essentially, if you're taking care of yourself otherwise, and your heart is the main issue. Now, the heart can cause other problems too. That's the problem. When the heart fails, it can cause the kidneys to fail.
Yeah.
I mean, we've done a transplant, a heart and kidney at the same time.
Oh, wow.
Already. Yeah, so we can do that. Matter of fact, we have another gentleman listed right now for both of those.
Wow.
So that is, we work really closely with our kidney transplant team to make that happen. And that is really a lot of work, right? So you have to.
It sounds like it.
So you have to. The heart has to go in first, and you have to do well for about a day. Which you think, wait, the kidney can wait that long? But the kidney can wait longer than the heart. The
Obviously,
the heart can only be out of the body for about 4 hours.
Okay.
And then you really start to have problems.
Yeah.
So. So it's a lot of coordination between that and our critical care doctors in the ICU. They play a large role as far as our nursing staff and physician assistants, nurse practitioners. Again, I don't want to leave out anybody because
cast of thousands.
It really is. It really is.
Yeah.
But again, in the end, it's an awesome outcome. And
yeah, it's a miracle. It really is. So. That has to lead to the question, what's the best way to prevent heart disease and heart problems that could lead to you needing a heart transplant?
Right. Well, obviously, I think, our state, unfortunately, has one of the highest smoking rates in the country. So I would say, please quit smoking because that leads to coronary disease, that leads to lung disease, that leads to lots of things down the line that have this. If you have diabetes, please take good control of your diabetes. If you're obesity, if you can try to lose some weight, be more active, those things help. Pretty much all the things that we talk about to try to living a healthy lifestyle and preventative medicine is huge. That's what we really need to focus on. Again, I have a job for a reason, but I really would love to treat less patients in that aspect of things so they don't get to me. So, we have an awesome team at WVU Medicine in prevention. We have preventative cardiologists as well that they'll be, watching your cholesterol, being on the right cholesterol medications, controlling your blood pressure. Things that probably sound like a broken record to a lot of patients who have those things, but it really is important. It makes a difference. It can really help prevent the need for this to happen, or God forbid, if you need it to happen, you're in good shape otherwise for it to happen. So
it's within your control.
It is somewhat, right? Some people have genetic predispositions, and you can't fight that, right? So we do our best to work around that. But if it gets to that point, then you want to be ready.
Yeah. All right. Well, then, I always like to ask this before we go.
Sure.
This is elevator pitch time, Dr.
Yeah.
Sokos. What's the most important thing you want our viewers to know about heart transplants and becoming
Well,
a donor?
Number one, I want to encourage everybody to be a donor. I think, God forbid if something would happen to you, you can help someone else. There are thousands of people waiting to be transplanted every year in the U.S. And if you are a donor here, you're registered here, it doesn't mean you can only help someone from West Virginia. You can help someone within so many miles of this, and it can be extremely helpful and life-saving. So I encourage everybody to be a donor. Again, I promise you, we'll take care of you and try not for you to be a donor. So don't keep
Right.
that out of your mind, okay?
That's probably the biggest myth, isn't it?
It is, and that's why I've said it, I hope 3 times, because
Yeah.
I really want people to understand that that's not the case.
Right.
But if you do find yourself in need of a transplant, you're going to get the best care possible in the U.S. in West Virginia, right here in Morgantown at WVU Medicine. And my team is dedicated and willing and ready to take care of anybody.
Excellent. Lucky to have that here. Dr. Sokos, thank you so much for giving us all this good information and encouraging people to become a donor. I'm a donor.
Me
I'm
too.
sure you are.
I am.
It's easy to do.
That's right.
But thank you for all your good information today.
Thank you for having me.
That brings us to the end of this edition of Tuesday Talks. If you're looking for more information about heart transplants, visit wvumedicine.org/transplant. And we encourage you to register to become an organ donor by visiting registerme.org/WVU-medicine. I'm Mary Ravazio Menard, and on behalf of Dr. Sokos and everyone at WVU Medicine, thanks for joining us and have a great day.